My name is Erin McCabe and I'm a fellow with the Department of Anesthesia and Perioperative Medicine in London, Ontario in Canada.
My fellowship is in obstetric anesthesia.
I'm a clinical fellow in neuroanesthesia.
I'm doing the cardiac fellowship in anesthesia.
London is a great place to live and work because it's such a diverse place.
I arrived here in London, Ontario about 3 years ago, and I found it for me the ideal place to be.
There is so much opportunity for learning, a lot of opportunity for teaching, and I also get exposure to other types of anesthesia during the days when I'm not doing my specialty.
So in London we have 3 different hospital sites that all have their unique patient population. With that unique patient population we are offering 10 different fellowships across these 3 different sites. Currently we have 23 fellows across different subspecialties.
We have 3 TEE rounds per week, every Monday, Tuesday and Friday mornings.
TEE rounds is a transesophageal echocardiography. This is a special technique that is usually a subset of cardiac anesthesia where we can look at the heart during the surgery using a probe that goes down the patient's throat and into the stomach and looks at the heart from behind.
What is also exciting for many of the trainees is this center, the CSTAR Center.
CSTAR is the Canadian Surgical Technologies and Advanced Robotics Lab at London Health Sciences Centre in the Lindros Legacy Building. And it's a fully outfitted simulation facility with the mannequin-based high-fidelity capabilities, cadaveric and animal facilities, as well as many part-task training environments. We try to give them as many skills and abilities to deal with difficult crisis management situations in a simulation facility so that they're well prepared when they have to deal with those circumstances in clinical environments.
When somebody decides to have a fellowship training here with us at Western, we also offer the opportunity to do some research projects.
So my time is split about 4 days in clinical work and 1 day for research work. My research is concentrated on heated humidified high flow nasal cannula oxygen therapy, which is one of the new types of equipment that is used for oxygen therapy these days, mostly in the ICU, but now we are trying to translate it into a perioperative setting where it can be used more and more in surgeries like awake craniotomies in neurosurgery. And that is one of the main focus of our investigations here at London.
I was able to present 3 abstracts at the SOAP meeting after a sort of 1-year fellowship, something that I was quite proud of. And in addition to that, the Society of Obstetric Anesthesia and Perinatology this year awarded us with the Centre of Excellence. And we're very, very proud of getting this recognition.
I like the community of a large fellowship group. We meet out of the hospital because we all come from different cultures. It's kind of an adventure, and for me the adventure was so positive that in the end I stayed.
Some of my favorite things to get are emails from previous trainees when they're out in practice saying, Dr. Cherry, I remember that time that we were in the simulator and we maybe did an emergency airway procedure. I just want to let you know I had to do that in real life in an emergency department and it went much better because I remember that experience in the simulator.
So as my fellowship is coming to an end, I'm so happy to say that the department has offered me a position as a full-time staff, and I'm so excited to start working here with this great group of people.
Anyone who hasn't been in this part of Ontario, I would certainly strongly suggest them to come and visit. The sunset is one of the most beautiful sights one would ever see. It's out of this world. Welcome to London, Ontario. We look forward to seeing you soon.
আপনাদের সঙ্গে আবার দেখা হবে.
Bienvenue à London, Ontario.
Ik hoop hier snel te kunnen ontmoeten.
Und wir freuen uns darauf, euch bald hier willkommen zu heißen.